There are fears the downgrading of emergency departments at some suburban hospitals will cause life-threatening confusion among patients and paramedics. The state government says its health plan will save lives, not cost them.
Quick decisions during an emergency can often mean the difference between life and death, and there are claims proposed changes to our health system will make those decisions even more difficult.
In the middle of an emergency, when minutes matter, they're asking people to make serious choices about their location.
That's because under the state government's health reforms, life-threatening situations would only be handled by super emergency departments located at the new Royal Adelaide, Flinders or Lower McEwen hospitals. Currently, many people make their own way to EDs or are rushed in by family, and there are concerns after the changes people won't know which hospital to head for.
It's so bad that you'd have to have some sort of special magical diagnostic tool that hasn't been invented yet. So you have to think that the people that have come up with these ideas have been watching too much Star Trek.
Health Minister Jack Snelling says anyone unsure about how serious their condition is should simply call an ambulance.
Don't self-present with a life-threatening illness. You're putting your life at risk, and if you're driving a car, you're putting other people's lives at risk as well.
But there are concerns paramedics will also be unsure because a patient's condition isn't always immediately clear, a suggestion Mr Snelling rejects.
It's something that they're trained to do, it's something that we can develop protocols around.
We would expect the Coroner's Court to be very busy over this.
Eddie Godfrey joins us live from Semaphore, and Eddie, locals there are protesting changes to the Queen Elizabeth Hospital.
Yeah, that's right, Brenton. They're just starting to gather down here at Semaphore, and very shortly they'll do a march along Semaphore Road here back to the RSL club behind us, where they'll have a meeting to discuss the state government's health reforms. There are many aspects about the health reforms that they're upset about, most specifically changes to services at the Queen Elizabeth Hospital not far from here. We asked Health Minister Jack Snelling about that today. He says he won't be changing his plans for the Queen Elizabeth Hospital, but the group here, they're pretty determined, and they say they'll keep fighting to get what they want, Brenton.
Eddie, thank you.